It's very interesting, this one. We see it quite often here, especially in Bulgaria. What is this organ? Do you see some normal preserved parenchyma of this organ? It's definitely parenchymal organ. This is a liver, great. So what is wrong with this liver? There's something that you can describe well. There are some small portions of hepatocytes which are situated in some fibrous fields in between some hemorrhagical changes. Cirrhosis, great. That is cirrhosis. Can you describe it now? I will spare my description. I think I should give you some ability to describe it by yourself. Take a look at the slide first on a large or a smaller magnification and then on a larger one and describe what you see. What do you see here? To call something with a diagnosis, you should be able to give a proper description. Do you see central veins? Do you see portal tracts? What is the condition of these structures? How are they appearing? And what is wrong with the hepatocytes on the inside? Inside these nodules, if you will, regenerative nodules, we call them. What is the structure here? What is the structure? Great. That's great. So we see portal thread, which is having inside what? A vein, an arteria, and 1, 2, 3, 4 bile ducts. What is wrong with the structure? It should be positioned at the periphery of a hexagonal structure, which should not be surrounded by such thick fibrosis, and there should be centrally positioned the central vein, which we can observe actually here, but it's a little bit damaged. And again, proliferation of bile ducts could be observed. This is what we observe. Let's take a look at a smaller nodule now. Again, proliferation of bile ducts at the periphery with no specific structure. Let's take a look at a smaller nodule. Well, there you go. 1, 2 combined together, 3, 4. No portal tracts at the periphery. Couple of central veins here and there. And no normal circulation of blood in the sinusoids. These are formed regenerative nodules after a process of necrosis eventually or fibrosis. What is the cirrhosis complication of? What could it be due to? Hepatitis, okay. Portal hypertension, great, okay. So, that is great as an explanation. Oh, cancer. It could not be, sorry, again disappeared. It could not be due to cancer, but it could cause cancer. The regenerative nodules are very risky for cancer, especially hepatocellular one. But also cholangiocellular and some exclusions can happen. Anyway, so due to final stages of inflammation and fibrosis in hepatitis and alcohol abuse, whether it would be viral hepatitis or alcoholic hepatitis, Finally, we have development of these septi, which are merging with each other and are forming a huge regenerative nodule. Where is this fibrous tissue coming from? Where are these fibroblasts positioned? Usually they're next to the portal tract, and they are pushed to produce more collagen, like here. And also they start to grow and merge with neighbor fiber strands from neighbor portal tracts, finally forming these regenerative nodules. Centrally positioned as these could be central veins sometimes, could not be at others, but the function of these hepatocytes here is completely lost because there is no normal leakage of blood from the portal tracts to the central veins. What else do we see here? Some small regenerative nodules formed or beginning of regenerative nodules, huge fields of fibrosis, proliferation of bile ducts, very often expected here, stasis of blood, and the hepatocytes here and there might be with more than one nucleus. Now, I don't see such here, but that's a normally expected stuff. What is this yellowish pigment inside? In the hepatocytes? Yes. How do we call this process when there is stasis of bile inside in the hepatocytes? We call it cholestasis because there is actually lack of leakage out through the bile ducts of the bile. That is why it stays staying inside. The structure is everything. I'm not quite sure whether I understand your question. Can we still distinguish the structure, the triad, if everything has a very thick wall? Well, I don't distinguish the structures here of the triad. Here I don't see any, actually. What I observe here exactly this field, yes, which can be named easier, yeah, but I don't see a triad here. Where do you see it? I see random sinusoids and hepatocytes with stasis of bile. I don't see a triad here. There you go, hepatocytes again. Many of these here. Fibrous tissue, couple of. Inflammatory infiltrates. It's normal to happen. And if I take a closer look, I might be even able to take a look at the hepatocytes, which are regenerative. And some of these I might be able to see nucleoli on the inside. This, according to me, is a hepatocyte with 2 nuclei, which is a regenerative one. And it could be randomly observed inside in regenerative nodules. But I don't see a thread here. At least not here, but I would be able if I take a look at other places on the slide. Now, this one is a remnant of a thread. Take a look at this one now here. No, we have triads. We have triads, but I didn't see that this specific field, which I showed you now, just in a minute. Now, take a look at this one now here. This is a triad, a remnant of a triad. There is artificial hemorrhage around it. Do not pay attention on it. What we should observe are the actually fibrosis, inflammatory infiltrate, and the vessels and the bile ducts. Remnant one here. It's a little smashed, not quite informative. Let's take a look at others. Now this one is very well distinguishable, but it's not properly connected morphologically to the surrounding structures of the regenerative nodules, and that is why it's not functioning well. We can see proliferation of bile ducts here And here one more. We can see a central vessel, which is what type of vessel? Venous or arterial one? Make a suggestion. What type of a vessel is that? It's having flattened endothelium here and not too many layers of the wall. So what type of a vessel is that? Is that a vein or an arterial vessel? Yeah, great, that's it. And finally, we see here an arterial vessel, which is bringing some blood here. So that is what I majorly observe here. Do you have any other questions about the slide? You should be able to say how many types of cirrhosis you know. You should mention micro and macronodular cirrhosis. You should mention also what are the complications of this process. You can mention that it's tumor formation. And I'm not quite sure whether you should be able to count benign conditions connected with fibrotic nodules here. So I think that we should skip this one. Yet, cirrhosis is a question which is marked here. Oh, also other complications connected with the condition of portal hypertension. That's something important to mention. What do you know as a complication here? Yes, varices on different places. So there could be caput medusae, varices of the esophagus, hemorrhoidal varices also, and those of the esophagus could bleed and lead to melena inside in the stomach. They could be ruptured. What else? Accumulation of fluid inside in the peritoneal cavity called ascites. Great. What else? Final stages when the toxins are released and splenomegaly, often, very often, also connected to cirrhosis. There could be the deposition of hyaline over the spleen after ascites, which you have observed as a frosty spleen. Very often we observe this, especially in corpses with severe cirrhosis. Spider angiomas, yes, due to the hypertensive. And then those lesions that are performed on the superficial layers of the skin. What else? Encephalopathy, which is connected to the final stages right before comatose appearance of these patients, when toxins are circulating and are passing the blood-brain barrier, damaging the brain and causing comatose condition, finally death of the patient. So also encephalopathy should be mentioned, connected with cirrhosis. What else? Well, testicle atrophy, gonadal atrophy, that is something normal to happen. What else did I miss? I cannot think of any others. I think we mentioned them all also. Okay. So, do you have any questions about this slide?